This is my butt.
So you sat on a flat iron?
Girl, I sat on a flat iron. I could not believe. I was like flat ironing on my bed. And then I was like, boop. I literally love it over here so much. I think this is it. It's 435, yeah. Okay, so this is it. Hi guys. I look a mess, but this is the fit right now. We're going to floor 4. Fourth floor. Okay, I think it's 405. Something like that. Wait, is this it? JK guys. It is number 402. Oh, skin intervention. Oh my god, look at all of the goodies. How cutesy. Oh my god, they have SkinCeuticals. You guys know I love me a good SkinCeutical situation. And they have Nutrafol. Love it. I'm so nervous. Okay, so I am at Dr. Zoe's office and I did put on a little bit of concealer because my skin has been like acting up really bad and I just did not want to really like show the full situation, but we're gonna see if she can help.
Hi, I'm Dr. Zoe. Nice to meet you.
Nice to meet you too.
We're gonna be right in here.
Okay, perfect. Oh my god, this is so cute. Oh my gosh. Oh my god. Okay, so I'm here with Dr. Zoë Indigo, and as you guys can see, we finally found a woman of color doctor, which I'm really excited about because I feel like one of the biggest misconceptions is that like black don't crack, which it don't, but it do. And also the fact that like our skin is just so strong and we can withstand anything. But I have found that our skin is actually way more sensitive.
The most sensitive.
The most freaking sensitive. So I've come to her and I have a few different issues, right? So I have this ridiculous lump on my back. I have hypopigmentation from this laser that I had done on my elbows, my knees. It's just a mess. Also, my ex, I think, you know, I don't know, that man put a little hex on me or something. I sat on a flat iron, so I have this really crazy scar on my butt. And then also my acne. I told her that I was on Spironolactone, but every time I tried to like wean myself off, the acne comes back. And this lady tried to prescribe Accutane. This is what my skin is looking like.
Okay.
Definitely. It's just like my acne kind of like goes a little bit crazy. Yeah. I've been trying to wean myself off of Spironolactone. I feel like my skin says, bitch, no. So this is kind of like where we're at right now. What would you say?
So I would ask a couple of different questions. I mean, you're definitely showing signs of hormonal acne. Spironolactone is helping. So that's telling me that it's responding to the hormones. Have you been worked up for PCOS?
Girl, no.
It's something I talk about with all my patients.
Really?
Yeah, definitely.
Okay.
Super stigmatizing. I'm like super grateful to like Lori Harvey, who has been more vocal about the diagnosis, but it's something that we often dismiss and we silence certain symptoms. But when you're seeing acne and you're seeing, you know, hyperpigmentation, especially around the jawline, it enters the differential diagnosis and it's something you should exclude.
So how do you do that?
So we go through some of your symptoms. So do you have any unwanted hair growth, like jawline or upper lip? Okay.
Upper lip, yes.
Upper lip.
But I just always took it as like I'm like a little Chewbacca. So like I've always been like really hairy.
Yeah, no, definitely.
Yeah.
And that can be part of it. A lot of it is genetics, but you know, something to think about.
Okay.
Any changes in your period, or do you have normal periods?
It's pretty normal.
Are you on a birth control?
No.
Okay. Any history of like painful periods or heavy menstruation?
I mean, I cramp, but not where it's like concerning.
Okay. Any family history of like diabetes or insulin resistance?
No.
Okay. So, you know, not all the time is it PCOS.
Okay.
You know, it's just something to keep in the differential and in the forefront.
But how do you confirm?
So you can confirm with a number of different ways. Blood tests help, especially if you're not on birth control. See, if you're on birth control, then now your hormone levels are like
they can like hide out.
Yeah, it's like elevated artificially. So you know, we would consider doing blood work.
Okay.
But also, acne is a medical condition in and of itself. So you know, it's about your genetics. So it's the root cause of acne is the oil gland.
It's my dad. My dad had acne. Like, yeah, my mom didn't really, but my dad. But I would be interested in just doing blood work too, just to confirm that it's not PCOS.
Absolutely. So we'll get your blood work just to make sure.
Okay.
I don't have a high suspicion for it, but because you want to know, more information, doesn't hurt. With that in mind, you've got dewy skin. Okay, you've got a lot of oil glands. You've got maybe more oil glands than you need. So that's when I like to think of my little friend Accutane. Have you ever heard of Accutane?
I have heard of Accutane, and I've heard such crazy things about Accutane, and I've been like,
what have you heard?
I've heard that it's like really bad for fertility, really bad for women, just like really bad. Basically, what I heard was like, it's not worth the risk.
Let's talk about it.
Okay. Oh my God.
We're going to get into it because Accutane really gets a bad rep.
It gets a bad rep.
It's gatekeeped. Like,
really?
Yes, especially if you grew up having access to a dermatologist. A lot of people had Accutane in their teenage years, and that's why they don't have acne.
Okay.
So Accutane is a little pill that you take for 6 to 8 months, and then you're done. It permanently shrinks the oil glands, and those oil glands, that's going to be the root cause of the acne. So if you're someone who struggles with acne, especially on the face and the back, you've probably got 1,000 oil glands versus like a baby that's born with 0, or your average person who has no acne who may have 100. So each month we're on Accutane, we're bringing your sebaceous units down to a normal amount so that you're not so acne prone.
How do you personally go about prescribing Accutane to your patients? Is it different from like other practices that you've heard about?
I think so. You know, a lot of docs will do that max dose, and that's where you get all the side effects. The dry skin, the dry nose, dry lips. Some of these side effects you can't get away from. Like, you're going to have dry lips on Accutane. But I often find that my patients don't have the same amount of joint pain or, anything like that because we're not going the max dose. It's really more art than science.
And so with you, so let's say, for example, I'm like, okay, doctor, go ahead and put me on Accutane. What do we do? What's the deal?
Yeah, so even if you wanted to start Accutane today, you can't.
Why would you even hype me up like this? What do you mean?
It's regulated by the federal government. So you have to wait 30 days. If you are someone with the uterus, you have to wait 30 days and prove you're not going to get pregnant before we can start Accutane.
So what does that even look like? So when you say prove, like, what does that mean?
So literally you can get over-the-counter negative pregnancy tests that you have to show at every appointment. Like, I legally cannot send the prescription if I don't show a negative pregnancy test.
So does that mean like, so if I'm like, okay, I want to start Accutane, do I have to do a negative pregnancy test today and then in 30 days?
Exactly.
Or just... Shut up.
Exactly. And I'll tell you why, because you wanted to talk about the fertility.
Yes.
Accutane, I tell my patients, it's worse than alcohol is to a developing fetus.
Okay.
Accutane is a high dose of vitamin A.
Okay.
So high that if a fetus is developing, the bones and the organs can malform. It's just too much exposure to vitamin A.
Is vitamin A, because I think vitamin A, is that like retinol or like a retinoid?
Yeah, exactly. Okay. So Accutane is actually in the retinoid family. So if you've heard of tretinoin or tazarotene, they're like the little brother and sister of Accutane. Accutane's the big mama.
Oh, shit. Okay. Yeah, go ahead, big mama. Okay, so we're thinking Accutane. Another question, just going back to fertility really quickly, because I don't have any children. Maybe not y'all. No. But for the women out there that don't have children yet, that are concerned about fertility, especially in today's day and age, just to recap, it sounds like you're saying Accutane will not affect your fertility as a woman. However, you should not get pregnant while on Accutane because it can affect the fetus.
Exactly.
However, it's not going to negatively affect you in the future once you get off of Accutane and you do want to conceive.
Exactly. You got it right.
So when someone is on Accutane, is there something that they can or cannot do skincare wise?
Yeah, so skincare wise, I often say you don't need the topical retinoids. You know, you're getting an oral retinoid. That's what Accutane is. Okay. It's the oral version of your, most potent, strongest tretinoin, tazarotene. It's an oral version of that.
Okay.
The jury's out when it comes to microneedling. If there is acne scarring, I will actually pair Accutane and microneedling together.
That's fair.
Because it increases the collagen formation, and as your skin is sort of turning over, we can take advantage of that repair.
Okay.
But you want to be careful.
Okay.
You really want to do it in the right hands. There were some data in the past that said you shouldn't get laser or laser hair removal.
Really?
And some places, especially if they're like corporate, they're just like, no Accutane, because they don't want to deal with the potential complication. But the skin is more sensitive when you're on Accutane.
I mean, okay. I mean, I will say that you definitely have like opened my mind to it.
And it's something to think about. And you got to think about it for at least 30 days anyway. So.
But if we think about it, do I have to say, okay, I do want to go forward with it, and then now starts the 30 days?
The 30-day countdown starts when you say.
Dun, 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 dun. Okay, so then that sounds good. So... okay, that sounds good. So possibly yes to that.
Okay.
So I start the 30-day contract. And then, you know, worst case scenario, 30 days comes, I don't want to do it.
Exactly.
We can just like cancel it. That's cool.
Because Accutane really is the only thing that's going to cure acne.
Okay.
Spironolactone is a Band-Aid. I've done it myself for years, and I had the glass skin.
Yeah.
But as soon as you come off of it, for me, I was freezing my eggs, so I had to stop it. As soon as you come off of it, that acne comes back.
Oh, question. Okay, so if I want to freeze my eggs, should I do it before Accutane?
I would freeze your eggs before Accutane.
Okay.
That being said, you can freeze it after, but you want to wait at least 1 month from your last dose because it's still in your system for 30 days after.
Gotcha. Hypopigmentation is like one of the hardest things to treat. If not, you can't ever treat it because like your melanin is basically gone. Can you give a brief explanation?
Never say never. Okay, never say never. But there's different reasons and causes behind the hypopigmentation.
Okay.
So, you know, there's vitiligo, which is an autoimmune condition. So if we can modulate the immune system, then we can get that pigment to come back.
Okay.
But a lot of the hypopigmentation that you're referring to is more scar-based.
Okay.
So because our skin, especially black and brown skin, is really good at healing itself, that scar tissue will come in and it will block the melanocytes from getting there. So clinically, that looks like hypopigmentation.
Okay.
So if we can do some in-office treatments like microneedling, radio frequency microneedling, where we can go a little bit deeper, as well as chemical peels and things to promote melanocyte growth, we can get pigment back.
Oh, okay. So it's not, I'm not officially ruined.
You're not broken. Okay?
I was like, my elbows, I don't have sexy elbows anymore.
We're gonna get your elbows together.
And this is, you can even do that even though it's very uneven. Like you can kind of see where the zaps were versus where the zaps were not.
Exactly. And I would say, you know, it's not like this is broken. You know, I just think that it's partially treated, but that you're having an inflamed response, and this may not be the right treatment modality for you.
Okay, I love that. Thank you so much. I feel like way better, more, you know, just like more secure. What about PIH, like acne scars? You guys, when I first found her, I'm like, this woman is like the queen of acne scars. And I really love that because obviously I'm black, she black, we all black with the bitch. So it's like, I know that with us, a lot of the things that other patients and other demographics can do, even something like a pico laser on like their body, it could really be more damaging for us. Yeah. So how would you treat acne scars? Because I do have them. And also, how would you treat hyperpigmentation like the burn on my butt? Do you even treat them the same way?
Yeah, I do. Okay. I do. So I always like to think about how the injury occurred and how long it's been there, because time is pigment. Unfortunately, the longer amount of time it's been, that pigment sort of drops down into our dermis and becomes like a part of us and harder to get.
Oh, wow.
With recent scars or recent hyperpigmentation, all that pigment's kind of right at the surface. So we can go in with a topical or even a peel and sort of lift that pigment out of there. Okay. Once it drops down, that's when I like to reach for something like radio frequency microneedling or something like a laser.
I heard that radio frequency is terrible for us.
You know, any device is dangerous in the wrong hands. Okay. I mean, honestly, a scalpel can create a masterpiece or it can butcher, you know? So I like to think about radio frequency microneedling. There's so many settings, you know, with the amount of power, the depth, the amount of heat. So all of these things are super important when you're treating darker skin tones and deeper skin tones, because our skin's more sensitive. So if you're just going in willy-nilly, just like you would treating everyone the same no matter what, then that's when you're going to see the complications.
So speaking of something like RF microneedling or chemical peels, like, so from my understanding, so a dermatologist and an esthetician med spa is kind of like two different things. However, you can have someone, you know, at your level who can do all of the things, right? So can you kind of explain what the difference is between a derm and an esthetician?
Yeah.
how they could work together or how they're totally different. And also, given some of the more advanced treatments that you mentioned, do you do that in office or do you just prescribe?
Yeah. So dermatologist versus esthetician. I mean, as a dermatologist, I'm a medical doctor. Like I went to medical school. I went to medical school. My classmates are your favorite neurosurgeons, orthopedic surgeons, eye surgeons, cardiologists. I then did 4 years of dermatology residency where I specialized in medical, cosmetic, and surgical dermatological care. So I diagnose medical conditions, I prescribe treatments, and create treatment plans. Estheticians, their zone is the epidermis, so that top layer of the skin. So I like to think that dermatologists and estheticians can work well together. You know, once I diagnose your acne, then I connect you with an esthetician to complete the plan and to help with the treatment. And oftentimes, even with our Accutane patients, we have them see our esthetician to help reduce any purging or reduce any dryness and things like that. So we work together.
Okay, I love it. And then speaking of that, so like you come in for your in-office treatments, you get your prescriptions. Do you still have to follow up with like a skincare regimen?
Absolutely.
Like how important is that?
Honestly, I mean, you know what? Could you get away with doing nothing on Accutane?
Please don't tell them that.
If you could get away with doing nothing, yes, but then you have the increased risk of purging or hyperpigmentation. So I always tell my patients, like, you know, how committed can you be? Because if you only want a 2-step routine, I got you, okay? A nice cleanser and a sunscreen.
Do you, like, what would you recommend? So, like, based on what you've seen, what do you recommend?
I recommend the Skin Tervention skincare line. It's formulated for patients' concerns. So we have our Accutane collection that features a green tea.
You have an Accutane collection?
An Accutane collection.
Oh, shoot. Okay.
Yeah, it has a green tea cleanser that's going to really help keep the skin calm. Reduce redness, because that's the one thing about Accutane. Your skin is more sensitive. So more sensitive to the sun, and you might have a little bit more redness than you might usually, you know, expect. So the green tea gentle cleanser is chef's kiss. Also, I like to combine that with the hyaluronic acid.
So you have them here? Can you show them?
Yeah, I do. Let me see. We have... So this is our salicylic acid cleanser that I recommend usually the first month of Accutane because it's still building up in your system. So you want to, you know, have that just to help exfoliate and reduce acne bacteria.
This has glycolic and salicylic in it. That's like strong...
Acid. But it's effective.
She said, hold up now.
It's effective, okay?
I love it.
And then I like our hyaluronic acid serum.
Hyaluronic acid typically breaks me out, though.
It depends. Hyaluronic acid is oftentimes combined with a lot of different things. So this one is pure hyaluronic acid with peptides that are going to like really clarify the skin, and it has some antibacterial properties in there too.
I love that.
Then I like to do our sunscreen. So we have our sunscreen SPF, and it's tinted and it's zinc. So this is why I tell my patients, like, most of the time when you see sunscreen that's tinted, if it doesn't have zinc, you are not protecting the melanocytes, the pigment-producing cells. So all of these sunscreens are chemical-based, and they protect the keratinocytes, but they're not protecting deeper those melanocytes. So you're not really treating the hyperpigmentation. That's the number one thing I'm counseling my patients on when they come into the office. So ours is zinc-based, and it blends. No white cast.
No white cast?
No white cast.
I love this because I heard that when you, especially as a woman of color, as someone of color, you have hyperpigmentation, that wearing tinted sunscreen actually kind of helps to, I guess, correct it or lighten it or something. Is that true?
It's the tinted sunscreen is like a shield. Okay. So especially living out here in LA.
Yeah.
You know, we're constantly exposed to the sun. So having that shield, that extra layer of protection is going to be super important. And then if you have a condition sort of like melasma or like, you know, dark spots on the face, it's a requirement for treatment.
Really?
Yeah.
Oh, I didn't know that.
Like, even if you would not have left my office without sunscreen on your elbows. Like,
I have my little jacket.
That's how important it is. Sunscreen is the foundation. So that's like a 2-step routine, a cleanser, and a tinted sunscreen from Skin Tervention.
I love it. So question, before we get into like some of the other treatments that you are recommending, for the people that are watching, you know, if you guys are not in LA, boo. But if you're not in LA, Can they even book an appointment with you? Number one. Number two, can they get your skincare line online?
Yes. So my skincare line is available to everyone in the world, worldwide. We've shipped actually internationally.
What?
Oh my God, France wants my skincare.
Congratulations.
Thank you. It's been a blessing. And then I can see patients because I have my medical license here in California, as well as Florida, New York, and there's some other states floating. So if you want to see me, please request.
I love it. Okay, so recap: acne, Accutane, hyperpigmentation, or like the PIH on my face. What are you saying for that? Just like peels or something? Or are you thinking prescription?
It depends. We'll take a look and we'll,
I'm going to have to wipe the makeup off?
Fresh face.
Oh, child. Okay.
We'll come in fresh face and we'll see. I would say a combination of, we can start you on a retinol today.
Okay.
Just to get your skin used to what Accutane is, what to expect.
Okay.
And then we can either do some spot treatments with some topicals, compounded brightening agents, and maybe even in-office microneedling just to sort of help everything penetrate a little deeper.
I love it. And then so for the butt, with this whole like little scar situation we have going on, it's just been like this ongoing journey. So this is my butt.
So you sat on a flat iron.
I sat on a flat iron. I cannot believe. I was like flat ironing on my bed. And then I was like, boop. And sat on it.
You really did sit on it.
I really did. So the top's like a lot better.
Yeah.
It's so bad, guys. It's so bad.
Have you ever treated this area?
I tried.
What did you use?
I tried with Tret, Tazarotene. I've tried, but maybe not consistently enough.
Yeah.
Microneedling, the laser. Also this like compound where it was like, I don't know, a whole bunch of stuff together. I tried hydroquinone.
Do you remember the percentage? Because that's a big part. Like, I have people who will come in and say hydroquinone doesn't work. I'm like, well, you were using 4%. Like, they're not all created equally.
I don't remember.
If you can find it, if not, we can just jump into a compound that I would recommend for you.
Okay. So, yeah, that's what I've tried.
And then we'll take a picture. I'll have it in your chart, too.
Okay.
Yeah, I think we can fix that, too.
No, you don't.
I do.
It's bad, guys. It's so bad.
I want to start with topicals there, just because how long has that one been there?
It's been there for years.
So I want to start with topicals, and let's see what we can get like as we resurface.
Okay.
And then if there's any residual pigment down, then we can go in maybe with a radio frequency device and sort of break up that pigment so that we can soften that scar. Because that's the thing, scars are permanent. They're permanent parts of our body, of our story. Like, that's part of your story. You sat on that.
I don't like that story.
You sat on that flat iron, okay? That's part of your story. Okay. But we can soften it, so that's not the first story you have to tell.
I love it. Okay. And then the lump on my back. This is the back.
We're going to look together. Let's find out what's going on. I see this. Okay. So I'm going to take a closer look.
Well, how do you do that?
I have my dermatoscope. And this is basically the stethoscope for a dermatologist.
Wait, let me turn the light so they can... It's a stethoscope. This is
like
so cool.
The stethoscope for a dermatologist, basically. So I'm going to take a closer look.
Okay.
And right now I'm looking to see if there's any punctum, which I don't see. And I always start with an ultrasound, especially especially when we're back here on the back.
Okay.
To see, if there's tethered, if there's roots there, because under the skin, we've got nerves, we've got muscle fibers, there's a lot going on. So I want to take a look with an ultrasound. We'll get you an ultrasound. Any pain or tenderness when I poke you?
No, it literally feels like nothing. It's just more so embarrassing to like rub my hand on it, or just to even have like the like dark spot.
Yeah, this dark mark here too. We can clean that up too.
Okay.
We can clear that up, I should say. And depending if it was like a routine cyst or maybe it was a mole.
Okay.
It's hard to say. We can consider getting an ultrasound, and then we'll do some pimple popping. Literally just numb you up. It's very superficial, and we'll pop it out. I like to send everything to the labs, and then they can confirm what it is. Was it a recurrence of the same thing? Was it scar tissue? We'll find out together.
Speaking of pimple popping, what's your history with pimple popping?
I am officially Dr. Pimple Popper's protege. She's actually on the last season.
Oh my god!
She's such a blessing. Dr. Lee is my favorite.
So you literally...
Oh, we were pimple popping.
Like, I was literally in there. I need to watch that. That's like sometimes when it's like super late, I'll be scrolling on TikTok and I'm like watching these pimple popping videos. So I can just imagine you like...
Oh, thank goodness there was a mask, because the whole time I'm like...
like, oh my god. Okay, and then last question. I'm sorry, I keep asking all the questions. The last question. Can you explain the difference between PIH, or like what it is, and just like regular hyperpigmentation?
Yes. Okay. So PIH stands for post-inflammatory hyperpigmentation.
Yeah.
Whereas hyperpigmentation is just a category. Like anything that has pigment is hyperpigmentation.
Okay.
Hyperpigmentation can come from a lot of different things. Just the sun causes hyperpigmentation.
Yeah.
Versus post-inflammatory means it was red first. It was irritated first. And because of that irritation, your melanocytes who want to protect you, they came in and they say, oh guys, we're irritated. Let's help. Let's produce pigment.
Yeah.
It's like, oh God, thanks, Mom. Thank you.
Thank you.
So that's why post-care is so important. No patient leaves my office without post-care treatment, especially in skin color. We got to keep those melanocytes calm. Nothing's going on. No need to hyperpigment.
I love it. Okay. And then I feel like that's it, unless, do you have anything that you want to tell the audience, especially our melanated girls and boys and whomever out there?
No, absolutely. You know, I became a dermatologist because I wanted us to feel heard and to feel seen. You know, our skin is different and requires different counseling and different understanding, and you know, it requires more hand-holding, more discussion, and I've created this space right here in the heart of Beverly Hills for us to really let our hair down and get into it.
I love it. Well, thank you so much for meeting with me. This has honestly just been like such a joy. I feel so at peace. One of the things that I am very open about, like along my journey, is how coming into this journey, seeing other groups of people at the places where I'm at a young age, at all types of ages. And it's like, why don't I see more of us in these spaces? Or why, when we do try to reach out, or we do try to go to doctors, like we feel unseen, we feel unheard, we feel dismissed. And then also sometimes those doctors respectfully just aren't necessarily equipped to treat our issues because they've not educated themselves, or they've just not had enough patients, that look like us.
And demand it. Yeah.
Exactly. So to be able to find you has been such a blessing, and I'm super excited to start this journey with you. I'm going to be with her for a life, but minimum like 8 months at least with Accutane, but forever. And I will 1,000,000% keep you guys along the journey, and I will continue to update you guys. And I'm just super excited. So thank you.
Thank you.
I know. Thank you so much. Okay, guys, until our next appointment, like 30 days when I have to do a freaking pregnancy test. We'll see. Okay. Bye. Bye.